Mommy makeovers have surged in popularity over the last decade or so. These procedures help restore confidence, comfort, and functionality for patients. My name is Dr. Joslyn. I'm a board-certified plastic surgeon here at Reno, Tahoe Plastic Surgery, a world's leading clinic. Today, I'm going to walk you through what a mommy makeover includes, who it's for, and what you can expect. What is a mommy makeover? A mommy makeover is a set of customized procedures designed to address your aesthetic and functional needs after having children. This can include procedures that address the breast, the belly, and sometimes stubborn areas of fat. There's a few other procedures we're going to discuss as well that might be concerning to patients after having children. What does a mommy makeover usually include? Usually it addresses the breasts. That can be lifting the breasts or augmenting the breast with things such as implants or fat transfer. It also addresses the abdomen. Usually that includes addressing the excess skin with something such as a tummy tuck or the excess areas of stubborn fat. That would be something that we would address with liposuction. The other procedures that it may or may not include would be excess skin of the arms or the thighs, and lastly, the labia. So who is a mommy makeover for? Well, the ideal candidate is somebody who has completed childbearing and somebody who is bothered by those changes that happened during pregnancy. The other criteria I like to look for with patients before proceeding with a mommy makeover is that they're within their ideal body weight or a couple pounds of that. They're nicotine-free and they're at their best physical and mental health. Nicotine is one of those things that can really impair wound healing. So it's really important that you are nicotine-free around the time of your surgery. For my personal practice, the patient should be nicotine-free for at least 4 weeks prior to proceeding with surgical intervention, but make sure you discuss that with your plastic surgeon. So which concerns can a mommy makeover address? Typically in regards to the breast, it addresses sagging or droopiness to the breast and loss of volume. In regards to the abdomen, we typically address that excess skin, loose saggy skin, stretch marks, or the separation of the muscles that occurs with pregnancy. It can also address your C-section scar. Typically, patients are bothered by the shelf that can occur after a C-section, and we help correct that contour abnormality. It also addresses stubborn areas of fat that can often occur around the abdomen, the thighs, the waist, places like that. One other area that these procedures can also address is your confidence. Oftentimes after we have children, we no longer feel confident or sexy in our bodies, and this is one way that we can help restore that confidence again. How long do these procedures typically take? Well, they can take anywhere from 3 to 6 hours, depending on which areas we're addressing. So what does the recovery or downtime look like around your procedure? Typically after surgery, we ask you to take it easy for at least the first 2 to 3 weeks, and then return to full normal activities around the 6 to 8 week mark. You can expect some swelling, tightness, bruising, and there's the component of compression garments as well. So what should you expect before your surgery? Well, first, you'll meet at a consultation with your board-certified plastic surgeon to discuss your desired aesthetic goals. Make sure you and your plastic surgeon are on the same page so that you can get the outcome that both of you are looking for. During that consultation, they'll also review medications with you and supplements, because sometimes we need to stop or hold some of these medications around the time of your procedure. We might also ask you to have some blood work done, and that's just to make sure that everything is optimized prior to proceeding with a surgery. Before your surgery, your plastic surgeon will likely draw on you with a marking pen. The reason we do this is to help identify landmarks and then also to give us a guide for where we're going to be making our incisions or cuts during your surgery. You will also meet with your anesthesiologist. Here at Reno Tahoe Plastic Surgery, we only work with board-certified anesthesiologists. These procedures are performed under a general anesthetic, meaning you will be asleep and not remember any of the procedure or feel any pain at the time of your surgery. So what can you expect after your mommy makeover procedure? When you wake up from surgery, you'll find yourself in a compression garment and a nice supportive bra. We typically have you wear those for a total of 6 weeks. That helps give you your ideal aesthetic result, helps diminish swelling, and helps improve contours. Can you have more children after a mommy makeover procedure? While it's physically possible for you to have more children after a mommy makeover, it's typically not advised because you're likely to reverse those results. Will scars be visible after a mommy makeover procedure? While your trading scars offer an improved contour and confidence, we strategically place your scars in areas that are very easily hidden. Definitely under normal clothing and often under most swimsuits. So how long will your results last? These are typically very long-lasting results as long as you maintain a stable weight and a healthy lifestyle. If you chose to place implants at the time of your surgery, it's important to remember that implants are not meant to last forever, and at some point you're going to need those replaced. Also, natural aging and gravity might alter your results with time. When should you schedule your mommy makeover? First, you should be done having children because you don't want to reverse those results. You should also maintain a stable weight and be close to your ideal body weight, as that will drastically change the results that you get. You should also have completed breastfeeding and no longer be lactating for at least 6 months prior to any breast procedure. You should also schedule your surgery around a time when you can take 2 to 3 weeks off and you have a lot of help at home. As a mom, there's often a lot that's asked of us, so make sure that you have somebody who can help pick up your child and place them in your lap. Things like that. You might have more questions, and we might have only just scratched the surface here. To learn more about mommy makeover procedures, visit worldsleadingclinics.com.